Welcome to Damal Consult Career Academy, your trusted guide for career growth and interview success. In today's video, we're focusing on maternity support worker interview questions and answers, with practical tips to help you stand out and succeed. Whether you're just starting out in healthcare or applying for your next role, these answers will boost your confidence and help you show employers that you're the perfect fit. Stay tuned as we walk through the most commonly asked questions and how to answer them like a pro. 1. Can you tell us why you want to work as a maternity support worker? I want to work as a maternity support worker because I have a deep passion for supporting women and families during one of the most important and vulnerable times in their lives: childbirth and early parenthood. I find it incredibly fulfilling to be part of a team that provides physical, emotional, and practical care to mothers and newborns. I'm particularly drawn to the role because it allows me to contribute directly to the well-being of both mother and baby by offering reassurance, hands-on assistance, and compassionate care. Additionally, I've always been interested in maternal health, and this role offers the opportunity to learn from midwives and other professionals while making a real difference. I value the chance to support patients with dignity and empathy, helping them feel safe and empowered during their maternity journey. Working in this role is not just a job to me, it's a meaningful way to impact lives while continuing to grow in the healthcare field. 2. What do you understand about the role of a maternity support worker? A maternity support worker plays a vital role in supporting midwives, nurses, and other healthcare professionals in delivering high-quality care to mothers, babies, and their families throughout the antenatal and postnatal periods. The responsibilities include assisting with personal care such as helping mothers with washing, dressing, and mobility, especially after childbirth. Maternity support workers also help monitor vital signs like temperature, pulse, and blood pressure under the supervision of qualified staff. They may assist during labor by providing physical and emotional support to the mother and by preparing delivery rooms and equipment. In the postnatal phase, the role extends to helping mothers with infant feeding, including bottle and breastfeeding support, changing nappies, and ensuring both mother and baby are comfortable and well cared for. They also help maintain hygiene in the maternity ward, prepare beds, clean equipment, and sometimes support administrative tasks like updating patient records. Beyond the physical tasks, a key part of the role involves offering emotional reassurance and being a compassionate presence during what can be an overwhelming time for new parents. They act as a calm, supportive figure for mothers and their families, ensuring they feel listened to, respected, and informed. Overall, a maternity support worker needs to have empathy, patience, good communication skills, attention to detail, and a strong sense of responsibility. They must also understand the importance of confidentiality, infection control, and working effectively as part of a team in a sensitive and dynamic healthcare environment. 3. How would you support a mother who is feeling overwhelmed after giving birth? As a maternity support worker, I understand that the postnatal period can be both physically and emotionally overwhelming for many mothers. If I notice a mother feeling overwhelmed, I would first offer a calm, non-judgmental presence and actively listen to her concerns. I would reassure her that her feelings are valid and common, and I would encourage her to express what she's going through without pressure. Depending on her needs, I might assist her with practical tasks like feeding, support, helping with the baby, or ensuring she gets some rest. I would also keep an eye on any signs of postnatal depression or anxiety, and report my observations to the midwife or nurse in charge, following safeguarding protocols. Overall, my approach would be empathetic, respectful, and supportive, helping the mother feel heard, cared for, and not alone during such a vulnerable time. Before we proceed further in this video, if you're currently preparing for a maternity support worker role, then this is exactly what you need. Our 50 Maternity Support Worker Interview Questions and Answers ebook is now available for instant download. Click on the sealer or fourth wall link in the description box below to grab your copy. It's very affordable, and we're currently offering a 70% discount, so don't wait. And there's more if you're interested in a few extra interview tips, plus a free PDF with 10 bonus interview questions and answers. Just send us an email or a quick WhatsApp message. In addition to our 70% discount, we've got a special bonus offer: buy one, get one free. When you purchase any of our ebooks, you'll get one extra ebook of your choice absolutely free. Just send us an email or WhatsApp message after your purchase, letting us know which bonus ebook you want, and we'll deliver it to you within 48 hours. You can also join our exclusive WhatsApp group to connect with others preparing for the same role. The link is in the description below. Want personalized help? Book a one-on-one coaching session with us using any of the links in the description box. To order now, visit sealer.co or click the fourth wall link. For any questions, chat with our online support on WhatsApp or email us. Don't miss out. Get your copy today and ace your interview. 4. Describe a time you showed empathy or compassion in a healthcare setting. During my training, I was assigned to assist a new mother on the maternity ward who had just undergone an emergency C-section. She was in visible discomfort and appeared emotionally overwhelmed. As a maternity support worker, my responsibility was to offer non-clinical support and provide comfort during her recovery. I sat beside her, listened attentively as she shared her fears and frustrations, and reassured her that her emotions were valid and understandable. I gently helped her sit up, assisted with her first walk post-surgery, and encouraged her when she expressed nervousness about holding her baby for the first time. I also updated the midwife on her emotional state so she could receive additional professional support. By the next day, she appeared more relaxed and confident, and she personally thanked me for my patience and kindness. That experience reinforced for me how essential empathy and compassion are in helping mothers feel supported and empowered during a very vulnerable time. 5. How would you handle a situation where a patient refuses your help? If a patient refuses my help, I would remain calm, respectful, and professional at all times. I understand that patients may feel vulnerable, anxious, or simply want more privacy, especially in a maternity setting. First, I would reassure the patient that I respect their wishes and that they have the right to make decisions about their care. I would gently ask if there's anything I can do differently or if they would prefer assistance later. Communication is key, so would try to understand the reason behind their refusal without being forceful. If the refusal could affect their well-being or safety, I would immediately inform the midwife or nurse in charge, as part of my duty to report concerns and follow the care plan. Ultimately, my role is to support both the patient and the clinical team while promoting dignity, choice, and trust. 6. What experience do you have with newborn care or supporting families? I have hands-on experience supporting mothers and newborns during both antenatal and postnatal periods. In my previous role as a healthcare assistant on the maternity ward, I assisted with basic newborn care such as bathing, changing, nappies, and feeding support. I also worked closely with midwives to monitor the well-being of both mother and baby, offering emotional reassurance and helping new mothers adjust to breastfeeding and early bonding routines. In addition, I provided guidance to families on safe sleeping practices and hygiene, and ensured that their cultural and personal preferences were respected. My experience has taught me the importance of patience, clear communication, and being a calm, reassuring presence for families during what can be an overwhelming time. 7. How do you ensure patient dignity and confidentiality in your care? I ensure patient dignity and confidentiality by treating every individual with respect, compassion, and professionalism at all times. I maintain privacy by speaking with patients in private settings when discussing sensitive information, and I always make sure that curtains or doors are closed during personal care. I follow data protection policies strictly and never share patient information, unless it is with authorized healthcare professionals involved in their care. I also support patients in making informed choices, respecting their cultural or personal preferences, and ensuring they feel heard and valued throughout their maternity journey. 8. What would you do if you noticed something unusual about a mother or baby's condition? If I noticed something unusual about a mother or baby's condition, I would remain calm and act immediately in line with hospital policies and the care plan in place. I would first ensure the mother and baby are safe and stable, then report my observations promptly to the midwife or supervising healthcare professional. I understand that as a maternity support worker, it is not my role to diagnose, but my responsibility is to observe, document, and communicate any concerns without delay. For example, if I noticed the baby was unusually quiet, or the mother seemed overly drowsy or in unexpected pain, I would inform the midwife on duty immediately and continue to monitor the situation closely. Patient safety and early intervention are crucial, so I would always follow the appropriate safeguarding and escalation procedures. 9. How do you manage stress or emotionally difficult situations at work? As a maternity support worker, I understand that working with new mothers and families can involve emotionally challenging situations, especially when there are complications or unexpected outcomes. I manage stress by staying calm, focused, and reminding myself that my role is to provide support and reassurance. For example, during my hospital placement, I supported a young mother who was struggling emotionally after an emergency C-section. She was anxious and tearful. I remained calm, listened empathetically, reassured her, and updated the midwife when needed. Afterward, I debriefed with a senior colleague, which helped me process the experience. I also take care of my own mental well-being by talking to my team when I need support, maintaining healthy boundaries, and practicing self-care outside of work. Staying professional, compassionate, and team-focused helps me navigate emotionally difficult situations effectively. 10. Why is teamwork important in a maternity care environment, and how do you contribute to it? Teamwork is absolutely essential in a maternity care environment because the well-being of both mother and baby depends on the smooth coordination between healthcare professionals. Midwives, doctors, maternity support workers, and other staff must communicate clearly, act promptly, and support each other to deliver safe and compassionate care, especially in emergency situations. As a maternity support worker, I contribute to teamwork by being reliable, proactive, and communicative. I make sure to follow instructions from midwives accurately, update the team on patient changes, and assist wherever needed without waiting to be told. I also treat all colleagues with respect and help create a positive, calm environment, which is crucial for supporting expectant mothers. I believe good teamwork not only improves patient outcomes, but also reduces stress among staff. And I'm always committed to working collaboratively to provide the best care possible. Do you have any question for us? Yes, thank you. I do have a few questions. What does a typical day look like for a maternity support worker in this facility? I'd love to understand the daily routine and how I can best contribute to the team. Are there opportunities for additional training or professional development in this role? I'm always looking to grow in my skills, especially in areas that support mothers and newborns. How do you support teamwork between maternity support workers and midwives or other healthcare staff? Building strong communication is important to me, and I'd like to understand your approach. Thanks for watching. We hope you now feel more prepared to take on your maternity support worker interview with confidence. If you found this video helpful, don't forget to like, share, and subscribe to Damal Consult Career Academy for more expert interview tips and career guidance. Leave a comment below if you'd like us to cover other healthcare roles. And check the description box for links to our coaching sessions and free interview prep resources. Good luck in your interview. You've got this.